So we're bringing you guys a consciously confused 34-year-old female patient. Sounds like she's having some increased anxiety today. Took 2 of her prescribed Concerta. Anxiety was persisting, so she ended up taking 3 of her Zoloft home. Mom called us just saying patient was behaving normally, getting quite lethargic, agitated at times, definitely confused. She's a little bit tacky, still at 110, and pressure's soft, 108 on 50. So she's pulsing her fluid right now, bringing her back in. Did have 1 bout of nausea vomiting, given Zofran for that. And we'll be in 5 minutes.
Just an update on your probable DK patient. He's currently unconscious, unresponsive to pain. He did have a tonic clonic seizure, which was treated with 2 milligrams of midazolam. We have 2 IVs going, giving him some fluids. He's sinus tach on the monitor at 108 beats per minute. 12 leads are unremarkable. Starting at 95% on 2 liters. We have an NTA in place. Pressure is now 161 on 102. Sugar's reading high, and we will see you in about 5.
General on road with a conscious alert, 35-year-old male complaining of some severe shortness of breath this evening, coming from White City. Was discharged from the Pasqua with pneumonia on, I believe it was Sunday. He was in there for 7 days. Sent home tonight, just a gradual onset of shortness of breath. EMS arrived. His stats were actually reading at 40. He looked gray, decreased LOC. They started treatment with nebs, as well as they ended up giving him a bit of epi because they didn't hear much air movement in his chest. He does not have a history of any breathing problems, although he is a smoker. Currently, his stats are fluctuating between 90 to 92 with a neb and a second source of oxygen. Heart rate is 150. We're giving him some fluids. He's had solumedrol. He also has a temp of 41. Blood pressure is good, and we'll see in about 10 minutes.
Hey there, we're on route with a 33-year-old consular male. Chief complaint of cold exposure to hands and feet, extremities. And some abdominal pain, left upper quadrant, described as a burning, 6 out of 10. Just had it for a couple hours, come and goes. Vitals are stable, and we'll see you in about 2 minutes here.
Has had multiple syncopes this morning with a history of staying in senior facility yesterday. There's a small laceration inside his left ear. Initial BP was 92 on 38, so we're doing a fluid pulse for that. Going to pace rhythm, other vitals within normal limits, and we'll see you guys in 15 minutes.
Coming to you with a 54-year-old female complaining of hallucinations. We've got their snakes in her stomach. She's vitally stable at the time. Admits to fentanyl usage and already sees both that.
Complaining of vomiting of some feces today. She has not had a bowel movement for over 2 weeks now. Has not been passing any gas. Is complaining of some general abdominal discomfort, rated as a 7 out of 10. States that she had 2 episodes of emesis with feces in it today, as well as has been burping up some pretty fecal smelling burps. She's vitally stable. She's had 4 milligrams of Zofran with us, and we will see you in about 5 minutes.